We would like to give you a short introduction on how we came here in this meeting, why we put this hold up in the dentist meeting, and then we will give you a very short introduction in vaccine hesitancy, what the role of the healthcare provider can be in this vaccination process, and especially in the communication about vaccines. How to improve the vaccine literacy of healthcare providers, and then tips and tricks on communication about vaccines in this setting. And we will end with the questions that we received from you on this topic. So who are we, or why we are here? It's in the framework of the IMMUNION, a European project that has as main objective to strengthen the forces and to increase the vaccine coverage in strengthening the forces of the coalition for vaccination, where we are working together with all members of this coalition for vaccination. These are healthcare providers that are or that can be important in the process of vaccination, and also the dentists are one of these groups. So we as the University of Antwerp are focusing on work package 5. That's a work package that's completely dedicated on increasing training opportunities. Therefore, last week we already organized the Train the Trainers meeting, where we trained trainers that could give trainings to healthcare providers or to students on how to communicate about vaccines. This training will later this year or beginning next year be translated into a national training in Greece, Latvia, and Romania on the communication of vaccines. The second part of our task is to make communication about vaccines more acceptable by all healthcare providers, and therefore we gave or we will give and gave already sessions in international events of the coalition for vaccination members. So we trained in March the general practitioners, and now we are here. And at the end of the year, we also will go for a training or a webinar like this, or a workshop in the pharmacy students organization. So who are we? We are the Vaccine Confidence Research Team that is located in the Center for Evaluation of Vaccination of the University of Antwerp. It's a multidisciplinary team where the lead is Professor Pierre van Dam, but we also have Aurélie Duval, who is more dedicated to communication, and Sarah Valks, and I am more the researcher, and the administrative support is Brenda Janssen. In our team, we also are taking care of the European part of the Vaccine Confidence Project that is led by Heidi Larsson. To give a very, very short introduction on vaccine hesitancy. Vaccine hesitancy is defined by WHO as the delay in acceptance or the refusal of vaccines, even or despite the availability of the vaccines and the vaccine services. It's not one point that you are vaccine hesitant or not, it's a continuum between all people who are accepting all vaccines and what we then call more the vaccine hesitant people or the anti-vaxxers, the complete refusal of all vaccines. In between that, there is a continuum, what we call vaccine hesitancy. Vaccine hesitancy is nothing new. It's not with COVID that it exists. Here you see some picture or cartoons that warning you for severe events that may happen if you got the vaccine, and it started already in the 1800s when Jenner gave the cowpox vaccines, that you can see that the people are changing and become cows. But it's also in the 19th and in 20 years that you see these cartoons popping up to to mislead or misinform people on vaccines. To avoid that this misinformation and this vaccine hesitancy can have an influence on the coverage of the vaccine, WHO decided to integrate vaccine hesitancy as one of the top 10 global health threats, meaning that they give really more attention on also on vaccine hesitancy to secure the health of all people in the world. Vaccine hesitancy is a worldwide problem, but if you see the data from 2016 on the Vaccine Confidence project led by Hedy Larsen, you can see that the red colors are the countries who were less convinced that vaccines are important. And then you see especially Europe is really coloring very red with some very hesitant countries. And then we are going to France and Bosnia. These are the most hesitant countries in Europe. Still at the moment, there are some European countries, also if you do studies on vaccine confidence on COVID, you see that the acceptance there is lower than in other countries. What are the determinants of vaccine hesitancy? If you study it, you have three different categories. So you have the specific issues that are more related to the vaccine itself, to the way how it is administered, to the supply. But you have also individual determinants, the determinants of really the person itself who received the vaccine. So his belief, his knowledge, also his prior experience or his past experience. And then you have more the contextual influence. And there you see that also religion, culture, but social, economic, and political issue can influence people's acceptance of vaccines. So these are the determinants. So now we want to discuss the role of the healthcare provider in the vaccination process, and therefore I give the word to Professor Pierre van Damme.
As shown in the introduction on vaccine hesitancy, we have to understand that the role of the healthcare professional comes back and has an important role to play in the whole concept of vaccine confidence and vaccine hesitancy. We can see it here on the slide for the vaccine and vaccination specific issues, but also when we talk about individual and social group influences, the trust in the health system and in the provider is tremendously important and comes back in the literature and in the studies that were performed on this topic. Even before, and this is from the European Barometer 2019, so clearly before the COVID-19 pandemic and crisis, clearly people do consult a doctor in 80% of the cases for information on vaccination. So doctors are trusted in general, and I think we can also say that healthcare providers in general are trusted to get information on vaccines and vaccination. And then amazingly, if we then look at the European Barometer 2022, this is really after or even during the current situation of the pandemic and the availability, of course, of COVID-19 vaccines. Healthcare professionals, doctors, nurses, pharmacists remain a very important source of information, as we can see here, a trusted source for many people. And that's something that is really key in raising the awareness, raising the information, but also raising the confidence in the general public. We do know, in the meantime, also from many studies that healthcare providers do have an impact on vaccine confidence if they themselves are confident and really convinced of the importance of immunization, and they follow the national or European recommendations, that will have a major impact and will be a driver for vaccine uptake among their patients and among the general public. On the other hand, if healthcare providers are really lacking information or are doubting themselves, also this will have an influence on the attitude of their patients.
So, and for preparing this meeting, we wanted to know what is already known about the vaccine hesitancy and the vaccine attitude in dentists or in dental students. Therefore, we did a very quick survey on PubMed, and we were looking for the vaccine hesitancy and vaccine attitude, and it came up that 146 results we had on publications that describing this, and it's as you can see, it's more concentrated in the recent years because you had the COVID, and also there was some research done. But also prior to COVID, there were already several studies on vaccine confidence and among dentists. What was important to see during the COVID, it is that they did a study on the acceptance in general. Overall, the acceptance of the COVID vaccine was 85% of the dentists accepted to be vaccinated. But if they made a search on the people who are working or not working at that time, they see that there is a correlation between the acceptance of the vaccine and the fact that they are working. So if more people are working, it seems that less people accept the vaccine. So the next study, it's a study in Egypt where they surveyed the dental teaching staff, and they saw that more than 50% of this teaching staff were not willing to receive the COVID vaccine. So there was a little bit the hesitancy, and we fear that this hesitancy will also given to the students so that they will not talk about the vaccine itself, not give them the proper information to deal them later on with their patients.
Att det gör ingenting att vara vaccinella. Kom nu inte ihåg att vi sa det. Att vi sa att vi inte skulle bry oss om det här.
Somebody who has this...
Can you mic, please?
Can you mute?
Jag är helt säker på att vi sa det.
Ja.
Jag såg det.
Yeah. Okay. In a very recent study in Switzerland, where they went into the acceptance of all vaccines among the dental healthcare workers, you can see that 95% were vaccinated for hepatitis, but there was still a big gap and lack for HPV and influenza. And what was there also seen was that a considerable amount were not even aware on their vaccination status. It means that they don't have any interest in the vaccine itself for them to protect themselves, even not. So the next study that was done on the COVID vaccine itself, then it was a recent study where you can see that they investigated the influence of the dentist, and it seems that they play a critical role in advocating for providing vaccination to their patients, so they can see that they can convince patients to take the vaccine. And in this case, it was for the COVID vaccine. So, but that most of these healthcare providers doesn't have enough knowledge, so they are lacking in knowledge. So it's very important to train these dentists so that they feel more confident to speak about vaccines. The same was done, this study also for HPV. There it was seen that dentists could have a very strong recommendation to increase the vaccine uptake on HPV, but also there most are missing communication training and training on the vaccine itself. And so to feel more confident to council for HPV vaccination. In America, it seems that it's allowed that dentists can vaccinate, and there did research on the willingness to administer the vaccine among dentists. And it seems that 91% are convinced that it could be a role of dentists to vaccinate, that currently only 2% really vaccinate, and that the major drawbacks or the what they are still missing is especially training. That's the biggest part that they are missing, but they also would like to see financial support to purchase the necessary storage for equipment to store the vaccine, and that they also don't have access to the protocols on how to handle the vaccine. So we can conclude that in the all literature that is available, that dentists wants to be involved in administer vaccine and also in consulting for vaccines, but that they are missing especially training, and that they are not very confident to talk about vaccine. And that's something we would like to change with the training that we are organizing.
So the next topic is how to improve the vaccine literacy or health literacy in general. And as part of a number of European projects we were involved in, and Gerrit has referred to that also in the introduction, a vaccine training barometer has been developed. And what was the reason for that? Well, in fact, the aim was to assess the need for vaccine training among healthcare providers, to monitor also the confidence of these healthcare providers to communicate about vaccines and vaccination, and finally also to collect questions healthcare providers could not answer. And as you can see from this table, and I will help you through it, we have done 2 pilot surveys, one in Flanders, Belgium, and one in Spain in December 2020. So that was really before even COVID-19 vaccines were available. And we can see that more or less 20 to 30% of the interviewed healthcare providers feel confident to answer questions about vaccines. So this is rather a minority. And in the last 3 months, they got questions that they could not answer in between 35 and 50% of the cases. Clearly, all of them, or almost all of them, are willing to follow extra courses. And they are also very often critical about the standard education they received at university or at high school. And if we look then at the broader study and survey that was performed in June 2021, when the vaccines were already available in Europe, this is among more than 3,200 healthcare providers. Again, we can see that 50%, a bit more than 50%, feels confident to answer questions, but that means that almost 50% does not feel very confident to answer the questions, and that more than 50% were not able to answer questions that they received in the last 3 months. So that's also a very interesting alarm sign. Finally, if we look at the willingness to follow these extra courses, well, again, we are close to 90%. I think it's equally important also to look at the future generation of healthcare providers in Europe and probably globally. And for that reason, we also surveyed students that were in a healthcare provider training program. So at university or at high school, we looked at their vaccination status, their knowledge on vaccines and vaccination, the attention that was given to that vaccination in their respective curriculum, but also the attitude of the student towards vaccines and vaccination, and finally also the confidence they have with vaccines in general. And I will just highlight here 2 of the important results. If we look at those who feel enough attention has been paid to vaccinology in their curriculum, clearly there is a lack of attention for easily 57% of them who say, well, too little time to spend on vaccinology on the one hand, and on the other hand, no major parts of the vaccinology or major parts of vaccinology are missing in their curriculum. So I think, again, this is a very important alarm sign. Also, the time that is spent to be trained in vaccines and vaccinology is going from a few hours to a number of days in a 6 or 7 year curriculum. So also that will raise a number of questions for the future. And that's one of the reasons why within the frame of these European projects, a curriculum was developed that can be used for in-service training and also, of course, for the pre-service training, and is composed of a number of modules so that people can also decide to refresh their knowledge on a certain topic like immunology or immunopathology, or really to have up-to-date information on immunization policies and schedules or future perspectives. There are plenty of examples of vaccine education for healthcare providers in the different countries, and very often, I must say, organized by the professional organizations of pharmacists, dentists, healthcare general practitioners, and so on. So I think the role of these professional organizations is increasingly important to raise knowledge, awareness, and confidence in the vaccines and vaccination programs. You can also find information from the European Centers for Disease Control and from the World Health Organization European region on the website of the Coalition for Vaccination that is shown here. And in the near future, new material will be posted and be available on information, how to inform people, how to bunk and debunk the misinformation. So in conclusion, so far we can say that healthcare providers are a very important source for information on vaccination, very trustful. The role in maintaining vaccine confidence is crucial. We all know that, and we have experienced that in the recent 2 years. And the attitude and behavior of these healthcare providers can be quite influential for their patients. Healthcare providers are often not aware that they can play such an important role. A significant of those healthcare providers and health students lack confidence to answer questions and lack also the knowledge. And so there is a need and clearly a willingness to follow the training.
Okay, so because of this need of training and this important role of healthcare providers, I will talk a bit about how to communicate about vaccines, because as a dentist, you might be confronted with questions or concerns of patients, and your role as a healthcare provider in how to answer these questions can have an impact on the attitudes of the patients about vaccination. So how can you be confronted with concerns and questions? You might see patients who talk about vaccination or who ask questions like you can see on the slide. And as a health worker, you have an important opportunity here to promote vaccine confidence by answering these questions and concerns in a good way. So that is what we will talk about now. So as we've seen before, we have this continuum of vaccine acceptance, and based on what a patient is saying about vaccination, you can get an idea of where this patient is on this continuum. You have patients who will accept all vaccines, but you will also have patients with questions or concerns who are mainly in this yellow part of the continuum, who are vaccine hesitant. But you can also be confronted with patients who are very strongly against vaccination and refuse all vaccinations. So it is important to get an idea of where the patient that you're talking to is on this continuum, and then to tailor your conversation and your answers to where you think this patient is on the continuum. So when you think a patient is actually a big refuser of vaccination and is very strongly against vaccination, you should think about how to respond to this refuser. We have some kind of step-by-step guide on how to respond to a refuser. And we see that it is important not to dismiss the statements of the refuser and not really to go into a debate. More importantly, you should really focus on the concerns that they are expressing and also acknowledge their concerns. For example, you could do this by saying, I would like to understand your decision. Can you tell me more about this? So this is a way to focus on their concerns and to acknowledge their concerns as well. Then if they have talked about their concerns, you can acknowledge them. And then you can ask their permission to share your view or your knowledge about vaccination. For example, you can say, I can see you have done a lot of thinking about this, and I understand that you are concerned about vaccines, but if it's okay with you, I'd like to give you my view. So in that way, you're being respectful, but you're trying to share your knowledge with that patient. So if you have this permission to share your knowledge, it is important to give you a strong recommendation for vaccination. And share expert info. So share the expert info that you have, or maybe refer patients to other sources with trustworthy information. So really give your recommendation and share your expert insights. If the patient is a strong refuser of vaccination, then I think you won't be able to convince the patient with only one conversation. But what you can do is also inform them about the risks of not getting vaccinated. So you can say, I understand that you have decided not to vaccinate at this moment, but I'd like to share with you what this means. So even if the patient won't change his or her mind in that moment, it is important to inform them about the risks of not being vaccinated. And then as a final step, it is also important to let them know that the door is always open. You could say something like, you're always welcome to come back for another talk, just to leave the door open in case they would have further questions. So I think this is a nice approach for responding to a refuser who is very strongly against vaccination. But then you also have the people who are not extremely strongly against vaccination, but are just hesitant. They have questions, they have concerns. And when you are confronted with a patient like that, there is a technique called motivational interviewing that you could use. This technique is not a traditional didactic talk, so it's not that you're lecturing the patient about vaccination, but it's more that you will engage in a collaborative conversation with the patient. And that is an approach that is proven to be successful when talking to patients who are vaccine hesitant. Now, what is this approach about of motivational interviewing? You actually have 5 steps that you can do. And the first one is that you ask open-ended questions to patients who are vaccine hesitant. The reason for this is that you want to explore the main reasons behind their hesitancy. If you look at an example of this first step, you can see the first step on top of the slide. An example of open-ended questions could be, what is your greatest concern about this vaccine? Or tell me what you heard about the vaccine. So that's really an open-ended question to explore the concerns that patients might have. Then for the second step, you should reflect and acknowledge their concerns. For example, you can repeat what the patient says or what you think the patient means to reflect the causes of hesitancy. An example of that is, for example, saying, I understand that you want to make the best choice for your health, but you are worried about the side effects of this vaccine. Or I understand that it can be confusing to know which information to listen to. So you really acknowledge the concerns of the patient. Then in the next step, it is a good thing to affirm the strengths and provide encouragement to patients. So to really recognize the strengths of the patient and the strengths of their thinking. For example, you could say, I can see you have done a lot of reading and thinking about this vaccine. So in that way, you show respect for the patient and you affirm that he or she has done a lot of thinking. So this is something that is also very, very good to do. Then in the next step, you could elicit, share knowledge, and verify. So this means for the first thing, elicit, that you ask what the patient knows and that you seek to complete their knowledge. Then you can share your knowledge, so share evidence tailored to the concerns of the patient. And then finally, verify the understanding of the patient about what you have been saying. So for example, you could ask, what do you know about the side effects of this vaccine? So that is a way to elicit what they know about the vaccine. Then you can share knowledge, for example, by saying, if you agree, I can share with you some information about side effects. And then finally, you can verify if they have understood what you have been saying. For example, you could ask, does this new information help to clarify the side effects? So that is actually the fourth step. And then finally, you could summarize the interaction or the conversation that you had and indicate a concrete action that the patient could take. For example, you could say, it sounds like your concerns were mainly about the side effects. Now that we have discussed the common ones, what do you think you want to do? So it's a summary of what you have been talking about and a question about the action that will follow the discussion. So these were some examples of this motivational interviewing technique. I also have some sample messages to give you an even better idea of how you can implement this technique. For example, a common patient concern that you might be confronted with is concerns about side effects of vaccines. For example, you could have a patient saying, I'm not sure the vaccine is worth taking, since it sounds like the side effects are even worse than the disease. If you think about this motivational interviewing technique, you could answer this question or this concern by saying, I understand that you want to make the best choice for yourself. What side effects are you concerned about? If you have a patient concerned about safety, for example, a patient saying, I'm not sure what to do. Many people I know are saying that the COVID-19 vaccine was rushed, so it is dangerous to take it. Then you could answer this by saying, I can see you are unsure about this vaccine and how it was made. Can I tell you what I know about how this vaccine was produced? So this is asking permission to share your expert knowledge. And then if you are, for example, confronted with a patient saying, I read stories about this brand of COVID-19 vaccine online, that it isn't as effective as others, then you could say, for example, it can be very confusing with so much different information online. Social media and websites can spread false information too. You can get the latest on the COVID-19 vaccine from the source I trust the most and then provide the source that you trust for information. And you could also say, I'm here to answer your questions. So that is also an answer that acknowledges the concerns, shows respect for the patients, but gives a good source of reliable information. So if I should give some general tips or maybe a summary of what I've been talking about so far, I think the most important thing to know is that it is important to listen actively to the concerns of the patients. So show interest in their concerns and acknowledge them. Do not judge or minimize the concerns or questions of the patients. Always be respectful and avoid arguing with the patients. Respond with empathy and show understanding for the concerns. Also offer positive encouragement of the patient, but don't forget to give your strong recommendation for vaccination. So what I've talked about until now was how you can address this vaccine hesitancy in a one-to-one conversation with patients. But as a final topic, I also want to say something about how you can tackle vaccine mis and disinformation more in general. For example, in a public debate or when there is misinformation or disinformation on social media, there are some techniques that can be used. Usually these techniques can be used, for example, by policymakers and so on, but it's good to know about them because you can always apply them. For example, when you feel confident to react to misinformation on social media. So there are actually two techniques. One technique is a preemptive intervention called pre-bunking. This is an intervention to tackle misinformation before people are exposed to misinformation. I will explain this in a moment. And then on the other hand, you have reactive interventions like debunking. And this is an intervention to tackle misinformation after people have been exposed to misinformation. But first, I will explain a bit about this pre-bunking technique. So this pre-bunking technique is an intervention that you can do before people are confronted with misinformation. So the goal of this technique is to educate people about misleading techniques that can be used in misinformation. So what you actually do is you provide a warning to people that they could be misled, for example, on the internet, and you explain which misleading techniques can be used or are being used by people who spread misinformation. I have put some of these techniques on the slide. For example, the technique of fake experts is a technique that is frequently used. For example, on the internet, you have fake experts claiming things about vaccination that are not true, of course. So if you educate people about this technique of fake experts that is being used, then they will be able to recognize this technique, and then the chance is smaller that they will be influenced by misinformation containing this technique. You see some other examples of techniques on the slide as well. I won't go into much detail, but just to show you that there are a lot of misleading techniques, and pre-bunking is about educating people about these techniques to prevent misinformation from having an impact. Maybe one concrete example of an intervention using this pre-bunking technique is, for example, the Bad News game. It's an online game that is developed in collaboration with researchers from the University of Cambridge. It is a game that people can play, and in this game, they are educated about misleading techniques that are being used on the internet in misinformation. And by playing this game, you get to know these techniques. And the game has been shown to be effective in decreasing the impact of misinformation. So that is a very specific example. And then finally, we have the debunking technique. So like I've said before, this is an intervention that you can do after people have been exposed to misinformation. So it is actually an answer that you provide to misinformation. And there is a very specific way of structuring this answer that has shown to be effective in debunking a myth or misinformation about vaccination. So on the slide, you can see the structure for debunking. So when you want to debunk misinformation or a myth about vaccination, it is important to always lead with the fact. So first of all, state the fact. That is an important thing to do first. Then you should give a warning that a myth is coming, or you will be telling a myth. And then you can mention the myth that you want to debunk, but only once, because when you do it more than once, there is a risk that this myth will stick in the minds of people and not the fact that you want to convey. So warn about the myth and mention the myth only once. Then explain the fallacy. So explain how this myth misleads, or explain how or which misleading technique this myth is actually using. And then as a final step, state the fact again. So reinforce the fact multiple times if possible, so that you make sure that this fact is the information that sticks in the heads of people. So an example of this is, for example, a tweet. This was a tweet about a relationship between vaccination and autism, which is, of course, a myth, a very common vaccination myth. If you want to debunk something like this, for example, on social media, you can use the structure for debunking that we've just talked about. And on the right of the slide, you have an example on how to do this. So first of all, you can state the fact that, of course, there is no link between vaccination and autism. Then you can mention that there is a common myth that states that there would be a link between vaccination and autism. Then you can explain the fallacy, so why some people believe that this link is there. So you can explain the fallacy behind that. And then finally, you should mention the fact again to make sure that this is information that sticks in the heads of people. So to conclude, I want to give an overview of this when you should use pre-bunking or debunking in the public debate. We see that when you expect that there will be misinformation, you can pre-bunk. So this is a case when misinformation is not already out there, but it is expected. So then you can pre-bunk and educate people about misleading techniques in order to make them recognize misinformation and prevent misinformation from having an impact. When misinformation is already out there and people are confronted with misinformation, you can do something else. If the misinformation is not very visible, so if there is a myth, but it is largely unknown, you can keep monitoring with whole debunking, but just be prepared. But when you see that the myth or the misinformation is very visible, is shared a lot, also the framing is fixed, so people are always saying the same misinformation about this myth, then you can decide to debunk. So then you can use the structure of providing a fact, explaining the myth, the fallacy, and again, providing the facts. So that is a scheme to decide whether you should pre-bunk or debunk. But again, this is what you can do in the public debate. So that is something that you could do on social media. But if you have a one-to-one conversation with the patient, then it might be better to stick to what I've talked about in the beginning. So to use this motivational interviewing technique in a one-to-one conversation.
So we will now go to the questions that we received. So we will answer the 5 questions that we received. Meanwhile, if you have questions, don't hesitate to put them or in the chat or raise your hand. If you have extra questions, we will try to get an answer on this. So the first question, Pierre will answer this. And it's, in which way did COVID-19 shift the paradigm of vaccination being provided only by general doctors? After the pandemic, can we look into a competence of other healthcare professionals, including dentists, to administer vaccines, which would be useful in the future for other health threats and diseases, including HPV?
Yeah, I think it's a very logical question, and we have to admit that a large number of countries globally, but also in Europe, also ask pharmacists to offer vaccines. So not only, I would say, trained doctors, which is already a shift in the paradigm since more than 10 years in a number of countries. For Belgium, for instance, we have been looking at also including pharmacists to participate in the COVID-19 immunization program. And this is done now in a pilot phase. So it's always very helpful to go through a pilot phase to evaluate that pilot and then to try to implement it for a larger part of the country or the region. And I think equally, we should use the COVID-19 pandemic as a very important opportunity to look at other healthcare professions like dentists to administer vaccines. So I think that the question is very valid and very defendable, because the more we will have frontliners who are able to communicate about vaccines, but also to offer vaccines, the closer we are to certain hard-to-reach groups or underserved groups, and anyway, much closer to the general population. And that will also increase the confidence for choosing for a certain vaccine. And in particular, if you look at human papillomavirus vaccination, I think that also makes sense. I think we all understand that dentists are very much aware of this pathology. We have to understand as well that there are some legal issues, that if you offer vaccines to minors, so under the age of 18, the parents need to be present to give also their approval for this immunization. So these are things we also need to take into consideration. But I think it's very important to follow this up. And in a number of countries, in the phase 3 and 4 of the implementation of COVID-19 immunization, a larger group of healthcare professionals will be asked to participate in that immunization program. So that's something we really have to look at for the broader European picture.
So the next question is, what is the role that academia plays in informing healthcare professionals able to tackle vaccine hesitancy among their patients and the general population?
Well, Ingrid, if you want, I can comment on that. I think what we are doing today is already part of that role of our duty to inform indeed healthcare professionals and to try to explain how to address vaccine. But it can be multiplied in the organization of webinars in the different European countries. I think that is equally important in adapting the curriculum at the level of nurse schools and midwifery schools and, of course, universities, in the curriculum of dentists, pharmacists, doctors. I think that is equally important. And I really support the collaboration with professional organizations like as we are doing today, because we know that these organizations are very credible among their members. And so we have to continue to use this trust relationship with the members to bring the message across.
The next question that we received is, should vaccination be a topic be included in the health and environmental context of One Health? We will try to answer this question, but we don't know who asked the question. But if you could have some more information, or if the answer is not what you are thinking, please raise your hand and come in and guide us through this question, because we discussed it a lot and we were not sure that what we saw was really asked. So if you would like to have more information on this, please speak up. But Pierre will meanwhile try to answer or give an answer.
On the one hand, I think the immunization fits in a very comprehensive package of prevention that, of course, dentists offer already. A large number of the population goes to the dentist not because there are complaints, but also for a preventive checkup. And I think also the discussion and the conversation and communication and information on vaccines and vaccination fits within that consultation, offering a vaccine as well. So that's really fitting in a very comprehensive preventive package. On the other hand, if we look at the more broader aspect of the One Health concept, looking at animal health, at environmental context, and human health, indeed, with the change in climate on the one hand, with the larger mobility of people on the other hand, the frequent interaction now between the animal world and the human world, we have to understand that vaccines may play a more important role in the future with the emergence of new infections, of zoonosis, as we have seen now. And I think we will not be able to do it without vaccines and to prepare, in fact, ourselves in terms of protection against future pandemics.
So I hope this is an answer on the question. If not, please intervene or speak up. We will go to the next question then. This is a question more on communication. And the question was how to deal with vaccine misinformation and hesitancy among healthcare professionals, the so-called green doctors. Aurélie will answer this question.
So we see that this is indeed an issue. On the slide is an example from Italy, a study describing why some healthcare providers are vaccine hesitant. And we see that important reasons is that they indicate that they receive little or conflicting information about vaccines. So I think the answer to this question is a bit similar to what Pierre has said before, because I think the main solution to tackle this hesitancy is through education and training. So this starts at the level of education of future healthcare providers, So it could be very useful to include more knowledge about vaccination in the curriculum of their education, but also for in-service healthcare providers, training and reliable information about vaccination is important. So like we've said before, this collaboration with professional organizations could play an important role. For example, us giving this session for the professional organization CED is an excellent example of how attention to training is given by professional organizations. So I think this aspect of education and training is crucial in decreasing this hesitancy among dentists. What I also wanted to say is, I think in the question, there could also be the question of how you can deal with colleagues or other dentists who show this vaccine hesitancy. And I think when you are confronted with that, you can always rely on the communication techniques that we've talked about before, because you could use these motivational interviewing techniques also in a conversation with the vaccine hesitant healthcare provider, just to listen to the concerns and to try to give an answer to these concerns. So I think that might be a way to deal with this as well.
And then we have the last questions that was sent to us is, what is the main way and solution to tackle vaccine myths and disinformation? I think Aurélie can give a sum up, in fact, of what she was training before, because this will give an answer on this question.
Yes, indeed. I think you have two contexts. If you are in a one-to-one conversation with a patient or with another person who is really vaccine hesitant and who believes in this or disinformation, then I think the main way to tackle this is to use this motivational interviewing technique and to use the communication techniques that we've talked about before for these one-to-one interactions. But I think in a broader context, for example, misinformation on social media, then you can really rely on those techniques of pre-bunking and debunking that we've talked about, because we've seen from research that these techniques are effective in tackling misinformation. So pre-bunking is something that you can prevent as a preventive measure, to prevent misinformation from having an impact. But to address misinformation, you can do debunking to debunk myths or misinformation that is out there.
So this is the last question that we received. Now we open the floor, in fact, for questions that maybe come out of the audience. So if you have questions, please raise your hands. So are there questions on?
I'm just going to comment very quickly on the One Health question. I think Professor Van Dam addressed it exactly the way it was asked. So I think the one that the interest there was to see if there's already a clear environmental and animal health link that makes vaccination or immunization a topic that has to be addressed in this One Health concept, like many other topics like AMR and all of those. So yeah, that was definitely addressed by you. So thank you for that. It becomes more and more a hot topic, let's say, on the One Health agenda as well. They included vaccination and immunization lately. So this is what we wanted to have your opinion on, I think. So thank you for that.
Thank you. And I think equally, if we look now at pandemic preparedness plans, this goes much further than purely, I would say, infectious disease control and immunization and measures. It has also to do with a climate factor and a climate dimension. It has to do with mobility dimension. It has to do with human attitudes. So this is something we more and more understand, that it needs to be approached from a much more global and holistic approach, as you are referring to.
So are there still other questions? Because it was a hell of a job to really put everything together in 1 hour that we want to tell you. So we hope that we could convince all of you that your role in the vaccine and the vaccination process is as much important as other healthcare providers. So we would like to really stimulate you to talk about vaccines. If you don't feel confident, to look for information. And this is also an offer we do to the Dentist Society on its own. If you really want to have more information and you want to have more trainings as such, please let us know. We will not come to everyone, but we at least can do such a webinar, or we can spread this webinar that we now recorded and made available for all of you. But your role is very important in this whole process. That's what we wanted really to highlight.
Thank you very much.
Thank all of you for participating in this webinar. Thank also the organizers and the technical staff that was involved of making this happen. So I hope to see you somewhere, and with the message that vaccines are important and that the dentists can play an important role in that.